Hello everyone, my name is Dr. Ankur Khandelwal and welcome back to my channel. Today I'll be talking on a topic which is known as brain freeze and very commonly called as ice cream headache. So have you ever come across a condition where you have consumed a cold item like very cold water, cold drinks or ice cream, and immediately after that you are having a severe headache? So I'll tell you what is this all about. So this type of headache, when you consume very cold stuff like ice cold water, ice creams, cold drinks, and immediately during this consumption you have a headache. The headache is typically in the region of this frontal area and the temporal area. Sometimes the headache may be behind the eyes, which is the retroorbital headaches. Clear? But we need to understand why the headache occur after the consumption of these ice cold items. It is primarily because of the two reasons. When we consume these cold stuffs, it stimulates the palate as well as the posterior pharyngeal wall. So the palate is richly supplied by the trigeminal branches, particularly the maxillary division, which gives off branches like brachiopalatin and nasopalatine in the hard palate and lesser palatine in the soft palate. Also in the posterior pharyngeal wall, the sensory supply is by the glossopharyngeal nerve. So because of the irritation of these receptors of glossopharyngeal nerve and the maxillary branches, there is typically pain in the face as well as in the cranial regions, right? And the second reason is because you are consuming the cold item, there is local vasoconstriction. The blood vessels get shrink locally in the area of the palate and the posterior pharyngeal wall. And in response to this vasoconstriction, what brain does, brain sends signals to locally vasodilate the blood vessels. So the blood vessels will then immediately vasodilate in the area of the brain and also some part locally, and because of this cerebral vasodilatation there is headache. So there are two mechanisms. One is stimulation of the trigeminal and the glossopharyngeal efferents as well as the cerebral vasodilatation which occurs in response to vasoconstriction. And medically this condition is known as phenolpalatine ganglioneuralgia. It is known as phenolpalatine ganglioneuralgia. So do we need to worry about this kind of headache? Not. Of course not. This condition is very benign. It will last only for a few seconds to a max of 1 minute and it will go off. What is the treatment? The treatment is pretty simple. Avoid consuming the cold stuff which you were doing. And number two, you can rub your tongue against the palate and you can locally warm the area, or you can take one of your fingers and just do some warming in the area of the palate, and this will of course relieve your pain. So this is all about brain freeze, or in layman language ice cream headache, or in medical terms sphenopalatine ganglioneuralgia. If you have liked the video, do subscribe to my channel and share it. Thank you very much.